So breast cancer is the number one cancer among females all over the world, and also in Asia and Southeast Asia, and including Indonesia as well. And it is increasing in most parts of the world. Now the incidence, meaning that the numbers of breast cancer cases are increasing, but what we call the survival from breast cancer is also increasing. So that means that the treatments for breast cancer have become better and better. Yeah. So that's in most parts of the world, and including Asia as well. So some of the common risk factors for breast cancer, number one is age. So the older you get, the higher your risk of getting. The older the woman is, the higher the risk of getting breast cancer. In generally young patients don't get breast cancer as much as older patients. But what is unique about Southeast Asia and Singapore is that there is some young women do get breast cancer, but generally mostly women above 60 years old and above have a higher risk of getting breast cancer. Yes, that's right. Other common risk factors for breast cancer is obesity. So being overweight will increase the risk of breast cancer. Not having any children. Yeah, so you've never had any children before, you also have a higher risk of getting breast cancer. And alcohol is also, if you drink a lot of alcohol, you also have a higher risk of getting breast cancer. So these are some of the common risk factors. So there have been advances in every area, in surgery, chemotherapy, radiation. All of it has gotten better for breast cancer. So surgery, many years ago, almost every woman will need to have their breast removed, the whole breast removed if they had breast cancer. But these days, most women can have just a lumpectomy, just remove just one part, the part of the breast that has cancer, and then after that they may need then they will have radiation, and the results are just as good as having the whole breast removed. So a lot of patients actually think they still need the whole breast removed, and actually you don't need to have that anymore. Yeah. Other things also, there's newer chemotherapy drugs, new chemotherapy drugs that have improved the outcomes as well, meaning that patients are doing better with the new drugs, and new targeted therapy drugs as well. So targeted therapy drugs, depending on the type of breast cancer, there are newer types of drugs that have also improved the survival and improved the outcomes for breast cancer. And then I'll let Dr. Chu talk about the radiation as well.
Yeah, so the radiotherapy it doesn't cure cancer per se, but for those who have a lumpectomy or those who have lymph nodes involvement, so when they have gone to the lymph nodes, then the chances of recurrence is higher. So radiotherapy is to reduce the risk. Now, if you have the cancer on the left side of the breast, then the heart is underneath here. So sometimes when you can cure breast cancer, then 10 years later they have problems from the heart because you also radiotherapy the heart at the same time. So now we have this technology called active breath hold. That you take a deep breath in and you hold your breath, and the radiotherapy is given when you're holding your breath, so that you move the breast away from the heart, and then so that you won't have any heart problems later on in life. So this is the new thing. And the other thing, that the radiotherapy we have intensity modulated. That means the radiotherapy can aim where we want to aim. So it goes in a circle, and we can treat both breasts at the same time, not one breast alone, but both at the same time. Yeah, and very advanced breast cancer we can treat at different targeting. And sometimes when the cancer has spread for stage 4 disease, gone to the brain, we can accurately, they don't need to do surgery anymore, because the radiotherapy, we call it radio surgery. We can give a high dose to the part of that brain, and as if they had surgery. So that part of that brain and cancer will no longer work. So you actually, as if you're removing it, and that without surgery. So 5 days of treatment, you don't have to go for surgery. The effect, it's called radio surgery. Yeah, that's why it's called stereotactic radio surgery, SRS. And other parts of the body, like the liver and part of the bone, we also can give this kind of places, so that the long-term control, we're no longer talking about few months, we're talking about many years. even they have stage 4, they can probably live for a long time. So this is the advance because the software and the technology, the machine accuracy has improved. The technology so that we can see where we aim. Then we are very accurate. We are like the sniper, you know. No longer you shoot everything. You do a bomb everything, you know. Every of the patients suffer. But now it's much safer. We are homing on one spot only. Most of the time, they don't have any side effect because we only kill the cancer, not the normal tissue around. So
Not side effect at all?
No side effect, sometimes zero side effect.
Okay.
That's something.
For targeted therapy for early stage breast cancers, now we have over 90% of breast cancer patients who, if they need targeted therapy, about almost 90% or more of them are cured of breast cancer. So that is a big advancement. Yeah. And that's because of the new targeted therapy drugs. So we're curing a lot more breast cancers than we used to before. Now, unfortunately, obviously, that some patients present very late. So they present with late stage breast cancer, meaning stage 4 breast cancer. Now, these patients, we still cannot cure them. But even among these patients, they used to maybe live for maybe only 1 to 2 years. But now with the new targeted therapies, the average age, for example, for what we call the HER2 positive breast cancers, it used to be most of them would only live if they present very late for maybe 1 year. But then now, on average, if they get the best targeted therapy drug, most of them live on average even 5 years. So that's very long. So there's many breakthroughs for early stage breast cancer where we're curing more. And even for late stage breast cancer, many of them are living for many years.
But the important thing is to detect it earlier. So we have a mammogram, but a lot of people don't go for mammogram. So mammogram in Singapore, even in Indonesia, actually over 50 years old, we should go for mammogram every 2 years.
Yeah.
So we always say that pengesalan awal akan menyelamatkan nyawa. The same thing, if you diagnose with stage 1 and stage 2 cancer, the chances of survival is going to be more than 70 to 90%.
Yeah.
You diagnose with stage 3, it's 50%. Then you diagnose with stage 4, you cannot be cured. So the aim is actually to increase awareness for them to get early detection. And if you have a mammogram, cancer like calcification, about 5 millimeter, you can detect it on mammogram. You can never feel it in the breast lump. So 5 millimeter, we can detect it, and then they go for operation. It's going to be stage 1. And that is very important message to the public that you need to be active to go for screening mammogram. So the screening policy is between 50 to 80 years old every 2 years. But in the population in Singapore, for whatever reason, the 40 to 50 years old, there is a young group of women who have this higher risk of cancer for a certain stage. So we do it once a year. But at least 50 years and above, you should go for mammogram screening.
Once every 2 years.
Once every 2 years.
Females, not males. So for breast cancer, we always say is what Dr. Chu was just saying, it's a multidisciplinary effort. Meaning what it means is that you need many different types of specialties to come together. So for breast cancer, you often need a surgeon, who does the operation. You need a medical oncologist, someone like me, and a radiation oncologist, someone like Dr. Chu. So which one comes first depends on the type of breast cancer, because even among breast cancers, there are many different types. And as well as the stage of breast cancer. For example, if you have a stage 3 breast cancer that has spread to the lymph nodes and is very big, the surgeon may say it's too big for them to operate. So they may send to me, the medical oncologist, to do the chemotherapy first to shrink the cancer, and then the operation becomes quite easy. And then sometimes even that, after you've done the chemotherapy, the operation is still not enough, then you need to do the radiation as well. So that's where we all the three, the surgeon, myself, the radiation oncologist, and also even sometimes the radiologist who does all the scans, and the pathologist who reads the type of breast cancer it is, will all come together. We have in Singapore often what we call tumor boards. Tumor board is where all the specialties come together to discuss all the cases of the patients. So we do, that's how we say that. But then we discuss and then we present the case, each patient, and then each specialty will discuss, and then we discuss what's the best treatment for each patient.
So the screening usually is about 30%. 30% in the category, that means, so in the government policy, they say this is a group that we advise, but only 30% because a mammogram, you have to pay for it, so it's an X-ray. So people think that I don't have cancer, why? If I go and detect cancer, then it's bad, I don't want to know. Some people, they don't want to know, but it's a wrong thing, So to be a screening program to be effective, you need to have 70% uptake. That means 70% of the population take up the mammogram, then it be effective. Only 30%. So this 30% who actually they are more middle class, middle class or upper class. The lower class, they say, I'm working, I got no money, I don't go. But when they're detected, that's why they are detected very later in stage, and then there's a lot of suffering. So whereas the early one that detect stage 1, very happy, at least because you cannot prevent cancer per se from that group, but at least you can detect it early. Actually, it's cheaper because if you detect it at stage 0 or stage 1, you may not even need chemotherapy. So you have to change the thinking. The more early, the more you less suffer, and it's cheaper.
In general, for most cancers, we always say if they can go 5 years without the cancer coming back, then we say they have a high chance of being cured. Now for breast cancer, certain types of breast cancers, we need to monitor them longer. So it depends on the type of breast cancer. For example, the triple negative breast cancers, if 5 years time they haven't relapsed, then most of them will never have the breast cancer again, so they are cured. But some of the more common type of breast cancer, what we call the hormone sensitive type of breast cancer, those kinds can still relapse after 10 years. So those ones you need to monitor for at least 10 years. Yeah, so we are both from a cancer center called Icon Cancer Center. Icon was originally from Australia, but then they moved into Singapore about 3 years ago. In Singapore, Icon Cancer Center runs cancer centers in all over Singapore. So we have clinics in most of the hospitals in Singapore, all the private hospitals in Singapore, we have a clinic there. So for me, I am in Mount Elizabeth, Novena, Mount Alvernia most of the time. But I also go to Gleneagles and Farrer Park Hospital. So whenever there are patients there, I will go. But most of my time I spend in Mount Elizabeth, Novena and Mount Alvernia Hospital.
We share the same. So whenever he tell me to see, I will see. That's simple.
So we go everywhere.
We go everywhere. But the important thing, no matter which hospital you are, whether which cancer group, the important thing is to diagnose it early, diagnose it correctly, and also to give the treatment early. But I think the important thing is to diagnose it correctly, and then diagnose it at an earlier stage. So sometimes in some people in places like radiotherapy is a huge problem. Not just in Singapore is okay, but other parts of the world around here, the machine is very expensive to build, and that's why the waiting list sometimes take a month, 2 months, 3 months. It's a huge difference. Whereas for radiotherapy, I can start the patient within 2 days because we have the capacity to do it. I think this is a setting. So my motive and ours is actually is the important thing is that I can share the knowledge with people so that I can tell them how to do it properly. Because at the end, if I see few hundred patients in Singapore, that's all I can help, few hundred patients. If I can help other doctors to improve their knowledge, I can help a few thousand patients without me knowing what, seeing them. Because at the end, we all are doctors, we are there to help and cure cancer. And we wanted to share the knowledge, and that's why we are here today, is we want to share. So tomorrow we are going to go to Maranatha University to speak to doctors, because important is that we share what we learned, so that everyone can benefit and use the same. Cancer, in a way, is very good that we are protocolized. If you have this stage, you just follow this, you should get this outcome. So actually, it's just a following protocol. You follow protocol, you should get the outcome. But the protocol, you must be tested, must be evidence-based, must be tried and tested. And once we follow this, so we can hopefully will be able to share knowledge. And I come from the UK. He's trained in Australia. I'm trained in the UK. So we are trained foreign. When we come back, our heart is still to help our own people around our own places, and that's why we are here today. I think. I think cancer is strike a lot of fear. The fear is because people think that they're going to die in pain. That's number one. They say it's going to be painful when I die, and when I die, I'm going to suffer before I die. That is the misconception. Because if the cancer is treated properly in the first place, you may not die. Okay. The second thing, we now have very good palliative care and good treatment that we can actually help the symptoms. Let's say you got pain straight to the bone, and actually we can give radiotherapy to the bone, and we got spinal surgeons who can fix the bone and put metal rods to stop this fracture. So there are other things we can do to help it. So cancer may not be, eventually we're all going to die. That's a fact. It's a fact. But they wanted to die without pain, and they want to die hopefully with faith. So we are Christians, and then we say that at the end of the day, our life on earth is limited. Our life is not in our hands, it's in God's hand,
Yeah,
it's
yeah.
in Allah's hands, right? So at the end, when we go back to meet our Maker, that is where we are supposed to go. So it is true, right? So at the end, when we are here, we try to live our life as happy as we can, as meaningful as we can. So sometimes the patient will ask me, Dr. Chu, I'm stage 4, what is there to live? Better give me something for me to kill me now, because I cannot afford your treatment, too expensive. Then just kill me now, isn't it better, you know? So I say, no, you see, because even if you have 6 months to live, then your 6 months of life is going to be the most important thing in life. I say that, what do you enjoy? You say, what is your regrets? Then help you to fulfill the regrets. So most of the regrets, number one, I did a survey of cancer patients, what they regret. Number one regret is that they work too hard. Number one in Singapore. Work too hard. I say, I work too hard. Now the money I earn, I cannot bring with me. It's so stupid, right? So the second thing, they say that I have not spent enough time with my family. And the third thing is that I have not looked after myself. They don't go for holiday, they try to save the money, save for the old age. But then they say, I never go for a holiday for a long time. So actually, the 6 months of life that you have, then you try to enjoy, spend time with family, and actually find your meaning in life. And sometimes a cancer patient, before they die, they really find that there's my real meaning of life is what? They go back and relook that. I tell you a story of how cancer changed a person's life for the better. So that this wife and the husband, they quarrel all the time. At one point, they're going to divorce. You know, so they are going to betray. So very angry because they like to shout to each other. So one day that the guy have a lung cancer, he's stage 4. Then the wife feels sorry for him. So he go and cook for him and look after him. So actually he find that for the first time he realized that the wife actually loved him a lot. So he said that the cancer saved my marriage. You know, that changed the whole perspective of why. So they say, so I'm very grateful. Then he said that, then the wife said that, you know, although we cannot grow old together, but at least God gave us a chance to be together. That is enough.
Yeah.
That is very meaningful, right? So we have to look at that and we feel happy that the relationship given by God is what we have, and cherish that. So the cherishment of life is important than how long you live.
Yeah.
It can be.
Yeah, so that's an important message that the patients must know, that, you know, everybody thinks cancer is, you get cancer, you're going to die, but it's not true anymore. You know, many cancers, if you catch it, you can cure, and then even if you catch it late, even something like lung cancer, right? Lung cancer, last time, most patients, if they get it, stage 4 lung cancer, most of them will be dead within 6 months, at the very most 1 year. But then now, with all the new treatments for lung cancer, some of them can be on tablets only, have a perfectly normal life and live for many years, you know. Yeah, so they will be surprised to know that with just very simple treatment like tablets, they can live a very normal life. They can go for holidays, they can still work if they want to, you know, they can still spend time with their family. So patients need to know that there are many new treatment options that they can help you live for a very long time still, with very few side effects.
So yes. One day we hope that cancer could be a chronic disease. Let's say your high blood pressure, it cannot be cured. Diabetes cannot be cured, but you can live for a long time because of a lot of medicine. So we hope with say at least 5 to 10 years, even if it's stage 4. And that is why the expansion of what we found in the medical science is so important now. We're living at the age where so many improvement, we are seeing the results coming through. And I'm very happy to say that our practice for me and him is more than 15 years. 10 years ago, we have not much. Now, there's so many options to go for. But of course, the new treatment now is very expensive because it's just new. Yeah? In 10 days' time, they will lose the patency of their new drug development. These drugs are going to be generic and be cheaper and more available. So in 10 years' time, you find that as it goes cheaper, more available to other people. Now it's very expensive.
More accessible.
Yeah.
Yes, that's right.
Klcbs, the chance way.